Hello, welcome to our information webinar for the Economies for Healthier Lives programme. We'll just start by giving some really brief introductions. So I'm Emma Spenceley and I'm one of the Senior Policy Fellows here at the Health Foundation. And I lead on a programme of work around business and economic strategies for health. And this programme falls into that programme of work. I'm just going to pass you over to Olivia now.
Hi, I'm Olivia McNeil. I'm a Policy Support Officer at the Health Foundation and I'll be the main point of contact for the programme.
Great, thank you. We'll just give a brief overview of what we're going to cover today. I'm going to try and keep it to under half an hour, but we're going to just cover a bit of background information about the Health Foundation and the context to the programme, give a higher level overview of the programme, talk about what we're looking for in applications and give a bit more detail about the application process, and also cover frequently asked questions. So thank you very much to those of you who have submitted questions over email. I hope you feel that your questions are covered through the course of this webinar. If not, please do get in touch with us and we'll do our best to answer your queries. So we're aware that for some of you, you'll be very familiar with our work. You might have already been funded by us in the past, and that for other people, we'll be a new organisation. So the Health Foundation is an independent charity committed to bringing about better health and healthcare for people in the UK. And as one of the largest endowed foundations focused on health, we're in a really fortunate position where we can give out substantial amounts of money in grants and research funding each year. And that enables us to really connect policy and practice. And we've been really delighted to have been able to launch this programme on the 9th of November. So just to try and give a bit of context as to why we care, I guess, about health and economic development. We are passionate in our belief that people's health and the economy cannot be viewed independently. So over the last few months, a lot of the media narrative has been presenting choices as health versus the economy. And we believe that's simply just too black and white. It just doesn't work. And we know that the economic determinants, so people's income, people's quality of work, people's wealth, have a strong influence on people's opportunities to live a healthy lives. And that conversely, good health is not simply an output of a fair economy, but it's a really important input. And we believe that health has to be seen as a core part of our social infrastructure and something that should be invested in to have sort of productivity gains and various other good outcomes later on. Conversely, we know when that doesn't happen and people who are living with poorer health have much more limited opportunities to participate both socially and economically. And I think COVID has really shone a spotlight on this, both the interconnections between health and wealth, but also the issues around inequality. So at the moment, we know that people facing the greatest deprivation are experiencing some of the higher risk of exposure to COVID, but also those already in poor health have more risk of severe health outcomes if they do contract the virus. And we're seeing that those in the most deprived areas have a 2.2 times risk of dying compared to those in the least deprived. But I think we all know, unfortunately, that inequality and that sort of level linked to deprivation is not unique to the pandemic. And there's just a chart here that we like to show in a lot of our sort of presentations showing that good health is not distributed evenly. And we can see here that the male healthy life expectancy, there's a sort of 18-year gap between the most deprived and the least deprived. And for us, we believe that gap is a sign of failure, I guess, to maximise the potential of a population and is something that should be addressed. And I think it's something that we believe is quite important, that we need to consider sort of the broader economic factors that are associated with health. And I think that background led us to want to produce a report which we published in September, using economic development to improve health and reduce health inequalities. So this report set out how economic development strategies can be used to improve people's health and reduce health inequalities in the UK. And it drew upon case studies that we partnered with RSA and Demos Helsinki to produce. Now, I would strongly suggest, if you haven't read the report and you're planning to apply for the programme, please do read the report, because I think the programme funding effectively puts some of the lessons, some of the evidence, some of the findings into practice. So as an example, there's sort of case studies of interesting work between public health and economic development within the report. There's various different frameworks and various sort of conclusions about some of the activity that we think needs to happen at national, regional and local levels. So there's a slight plug there. Again, I think please do read the report if you're planning to submit a funding application. So just to give a brief introduction to the programme, as hopefully you'll know, it is a £1.72 million funding programme to support up to 4 partnerships that aim to promote health and reduce health inequalities through the use of economic strategies. Partnerships will be led by a local authority or a statutory regional body. Now, we're expecting this to be an upper tier local authority, but that wouldn't preclude proposals that focused at a district level. It would just need to be the upper tier as that sort of lead partner. And they'll bring together a range of organisations. So we've had a number of queries about how partnerships will work, and I'll cover that off in a bit more detail in a few slides' time. Now we know each award will provide grants of up to 500k in total for up to 3 years. So it may be that with some setup time, actually 2.5 years is sufficient, it may be 3, but it's the ballpark of up to around 3 years. We'll have tailored support to partnerships through a learning support provider. Now, we want to work with the selected sites to make sure that that learning support is the most relevant it can be. So there'll be some things that are consistent across the programme, but there may well be things that are individual to each site, and we want to work with those partners to make sure that the learning offer is as good as it can be. And we'll also have a programme of activities. So we'd expect to have maybe action learning sets, events across the programme, but also to use our role as a convener, and again linking to this sort of policy into practice concept, to be able to sort of share emerging learning with key policy makers, with other think tanks, but also to connect people within this programme to other networks and other programmes that we know are out there. So just to clarify and to go through briefly the objectives of the programme. First one is to improve the capacity and capability of economic development and public health professionals to take joint action. Now, a few years ago, we commissioned a report by the New Local Government Network, and they were interviewing public health professionals to understand about the various relationships that they had. I think 85% of those interviewed felt that the relationships with economic development needed to be improved. And I think for us, it felt like there was a good opportunity to be able to put some funding into this space to try and support that. Now, we know there are areas that do this brilliantly, but I think we feel that there probably is a gap and something that funding could support. We want to develop a better understanding of the mechanisms through which economic development interventions affect health and wellbeing outcomes. Now, we're realistic that over the course of 3 years, we're probably not going to get solid outcomes data, given the sort of complexity of trying to apply economic interventions in health. So we're thinking about this as a much more developmental programme, where we're thinking about maybe theories of change, thinking about proxy measures. We don't anticipate being able to get solid outcomes data at the end of this programme. The next objective says to support the development of metrics to monitor the health and wellbeing impacts of economic development interventions. And it may well be at a local project level. There are proxy indicators that the academic partner can help. There may be data sets that need cleansing. So I think we see this as quite a practical focus. I think the fourth point around building understanding of how to translate the evidence base into practical action. So we think it's really important to understand the how of doing some of these programs and not just the outcomes. So Again, it's something where we'd see the academic partner being able to sort of potentially play a role, either through sort of sourcing evidence of best practice or through maybe doing sort of formative development work to understand, you know, are things working and should things be changed in real time. And more broadly, you know, for us to capture learning from the programme and where possible to be able to use and inform change across the UK through sort of wider dissemination. What type of work will we fund? So I think in the report, we highlighted a number of potential levers of economic development that can be used to create healthier lives. And the list is there. It's not exhaustive. You know, we're quite happy to consider other interventions, but I think it's more to provide an idea of some of the things that we're interested in. And I think expecting as well that in terms of sort of COVID recovery, we'd anticipate probably quite a strong focus on labour market programmes, but we're not necessarily specifying that's the only thing we're interested in. We're interested in sort of really broad range of different interventions. In terms of the types of expenditure we fund, we'd anticipate that probably a lot of applications will have quite a heavy focus on staffing costs, and that's absolutely fine. We're also fine to cover things like expenses and small payments for public and user engagement. Again, we'd expect quite a big chunk of the budget to be spent on subcontracting the academic and specialist partners. We're fine to do things like communication resources, attendance at conferences if they're linked to the sort of programme and event space. I mean, obviously, in the current climate, it's tricky to know how necessary some of things like meeting costs might be, but as we're thinking a 3-year timeline, we'd expect, hopefully, that, you know, a sense of normality will return and some of those costs will be needed. I think types of expenditure we won't fund, capital expenditure. So, you know, we're not going to fund sort of new vehicles or building refurbishment. Organisational overheads can be really challenging for us, and you know, we shouldn't be covering things like HR costs, electricity. If it comes to the point when you're subcontracting and there are issues, we can speak to our governance team, but at this point we are not asking for really detailed budgets in the expression of interest stage. I think we can go through some of this in much more detail with successful applicants at the final application stage. The other thing just to highlight, we absolutely couldn't cover are things where you've got costs that would be promoting or enhancing profit-making services. That would be very difficult for us as a charity. So we've had quite a few questions about the different roles of partners. So I'm just going to go through this diagram in a bit more detail. If you still have further queries, please look at our FAQ document, but also email us, and we're very happy to answer those offline. So I think firstly, we've got the Health Foundation. We will be the funder, but obviously also a convener. So we'd see our role, again, as sort of putting policy into practice, and where possible, if there's emerging findings, linking those through to policymakers, but also trying to make as many connections and to make the programme as live and as interesting as possible. We will then contract a learning support provider and work with them to develop the learning offer. I think I said before that we want to make sure that is as relevant as possible to the sites. So before we finalise that offer, we very much want to make sure that we've consulted with the likely sort of final sites. We will also be funding an external evaluation. Now that evaluation is for our purposes to understand if the programme has worked as intended. So it's a significant chunk of money, and we need to understand whether the construction of the programme, whether we had value for money, whether we should repeat it, whether there's things that we can do better. So that evaluation is very much about learning about the mechanics, I guess, of the programme. So then thinking about the partnerships themselves. So we need to have a lead partner that we hold that relationship with. So we want to know that we're speaking to sort of one organisation rather than having to speak and contract with 5 or 6. And we've said that we want that to be a local authority or potentially, say, a combined authority. Now, just because the local authority is the lead partner and the partner, I guess, responsible for the subcontracting, doesn't necessarily mean that that partner has to do the majority of the work. So moving down, we've also then got what we call the specialist partner. Now, we've been quite open as to what we mean by the specialist partner. So in some ways it's a slight catch-all, but our expectation is that the specialist partner provides either access or new knowledge. So for example, if an intervention was looking at a particular population group, the specialist partner could potentially be, say, a charity representing that group, or if we were maybe looking at a labour market intervention, that specialist partner could be a local, say, Bureau of Commerce, it could be a, say, national think tank. So we're quite open for you to tell us who that partner should be, and there can be more than one, but we're expecting at least one. And I think what we've said in the call document as well is that we do expect quite a substantial chunk, I guess, of public engagement and involvement, and it may well be that the specialist partner is able to support that. We've also talked about an academic partner being mandatory, and we'd see that the academic partner is very much a core part of the partnership, supporting work on the ground, and not being, I guess, a distant evaluator. So we would see the academic partner's role as sort of helping with evidence gathering, helping with theories of change, helping with metric development, possibly providing a degree of sort of real-time evaluation to the sites. So a really core aspect, but also quite practical. As I said before, we're quite interested in the how of some of this and not just the outcomes. We also recognise that some areas will have more and sort of better developed relationships with, say, local universities. So we are being quite open at the expression of interest stage about saying, you know, we understand that it might take a bit more time for some areas to secure that support. But we do need, if you haven't secured it at the point of the EOI stage, we do need you to talk about how you will and how you'd work with the academic partners for the full application stage. We also got a chunk here called other partners, which in part reflects the complexity of trying to run a programme across the 4 nations. So one of the things that we've said is that we do expect economic development and public health functions to be represented. Now, in some areas that will be quite neat because they'll both be within a local authority. We do know that obviously in other areas, public health sits outside of that. So where public health sits outside of the local authority, we would expect them to be involved and a mandatory sort of partner. We've also said in the core document that while not mandatory, we would strongly encourage the involvement of local or regional enterprise partnerships. Now I'm just going to pass over now to Olivia to talk a bit more about the application process itself.
So there are 3 stages to the application process. The first stage being expression of interest, which opened on Monday the 9th of November and will close at midday on Friday the 15th of January. Expressions of interest must be submitted through our application portal by the deadline. Late applications or applications submitted via alternative means won't be accepted. We'd encourage you to register and become familiar with the portal well in advance of the deadline to avoid any last-minute problems. And if you do have any problems, please just contact us. After the deadline, we'll review all expressions of interest and then invite between 10 and 15 partnerships to submit a full application. We're aware of the pressure the pandemic is putting on local areas, and a decision to go ahead with the programme launch and open for expressions of interest wasn't taken lightly. On balance, we felt like a decision to launch in 2020 rather than delaying until 2021 would better fit with timelines for local economic recovery planning. We've considered capacity concerns by designing a light touch expression of interest stage and allowing 2 months for expressions of interest to be developed. We'll consult with applicants on timing before confirming timelines for subsequent assessment stages. But at the moment, application stage 2 is set to open on Monday the 8th of March and will close at 5 p.m. on Friday the 7th of May. We'll then shortlist between 5 and 8 partnerships and invite them to interview. The interview stage will take place in June or July, but as I said, given the uncertainty about the impact of COVID-19, the timelines outlined here are subject to change. We want to remain as flexible as possible in response to feedback from applicants. So if you have any concerns about capacity during the application process, please just get in contact with us. So I'm now going to cover what we're looking for in applications. So what do we want to see in expressions of interest? We'll be asking partnerships to submit answers to 5 core questions. The focus should be on what our funding would specifically support, and applications should be clear about what funding would bring over and above existing plans. We'd encourage applicants to seek out the best available evidence on what works and use this to shape the design and delivery of proposals. We haven't allocated weightings, however, at the expression of interest stage, we're particularly interested in assessment criteria 1 and 3. Answers to each of the questions have a word limit, and word limits can be found in the call for applications and on the application form itself. There are no penalties for being under the word limit, and applications won't be assessed on the amount of information provided. So if you can answer the question in fewer words, please do so. Also, please be aware that if you copy and paste from the Word document into the application portal, your formatting may be lost. So make sure you leave enough time to deal with any formatting issues before the deadline. So now I'll quickly go over what we're looking for in your answers to the 5 core questions on the application form. So the first assessment question is, how would the proposal support health improvement or reduce health inequalities? So in your answer, we're looking for you to tell us why you believe the actions you plan to take will have an impact on health or health inequalities, what success would look like for your project, and how would you measure impact? And finally, how you'd ensure that any benefits last beyond the funding period. The second assessment question is, how would the partners work together? So in your answer, we're looking for you to tell us what engagement there's been so far between economic development and public health functions, whether or not there's an academic partner already in place, and if there is, how they'll support the process of putting evidence into practice, and if there isn't, how you'll find and work with an academic partner for the full application stage. And finally, we're looking for commitment for the work at a senior level from relevant partners. We had a pre-submitted question asking if there's a minimum number of trustees or directors required, and we haven't specified a minimum number of senior leaders required at this stage. However, at the full application stage, we'll be expecting a letter of support from relevant directors. The third assessment question is, how would your project meet the programme aims? So for this question, you just need to look back at the objectives of the programme that can be found in section 2.2 of the call for applications and clearly outline how your project would meet those aims. The fourth assessment question is, how would you collaborate with service users or the public to strengthen the delivery and outcomes of the project? So we expect a portion of the funding to be used for meaningful public involvement, and this engagement should go beyond existing consultation mechanisms. So in your answer, we're looking for you to tell us how you'd ensure that public or service users are able to participate and their voices be heard, and also describe how your project considers diversity and inclusion. The fifth question asks you to outline how you'd use the funding and manage risk. So in your answer to this question, we're expecting an indicative budget only. For example, a rough split across organisations or functions. Applications that proceed to the full application stage will be expected to provide more detailed budgets. Additionally, in your answer to this question, we'd like to think about why your proposal represents good value for money, what you think the greatest challenges are, and how would you manage risk. So now we're going to answer some pre-submitted frequently asked questions. So we had a few questions along the lines of, the programme will support local and regional partnerships. Can you clarify what this means? So we haven't specified what local or regional means because we aren't being restrictive, and it's really up to you to tell us what this means for your partnership. So for example, we had a question that asked, can county-based partnerships submit an application? And the answer to that would be yes. We also had a couple of questions asking us to confirm that local authorities in Northern Ireland, Scotland and Wales can apply. And yes, we absolutely welcome applications from all areas of the UK. The timescales for the award are over a 6-month period. What opportunities are there to tweak initial applications to reflect the changing context of COVID and its impact? So we're expecting proposals to develop between the expression of interest phase and the full application stage. We obviously wouldn't want to see a completely new project put forward, but there would definitely be opportunity to make adjustments to your initial proposal in the full application stage. So I'm now going to pass over to Emma to continue with the frequently asked questions.
We've had quite a lot of questions around the theme of would the funding support. So I'm going to go through a few of them, and hopefully even if it's not your question, it'll give an idea on some of the answers we might give more generally. So the first one, would the funding support local community initiatives? And I think the answer is really depends what those community initiatives are. If they meet the programme objectives, then potentially yes. What we wouldn't do is just say provide funding for an existing initiative if that funding had been cut. I think we do need to see things really closely linked to our programme objectives. Can the funding be used to fund a place-based post? Potentially, yes. So I think, as I said earlier, we're expecting that a lot of applications will include quite a big chunk of staff costs. And I think a place-based post could be entirely appropriate. And again, similar to the community initiatives question, I think we wouldn't just sort of fund something that might have lost its funding that was just sort of continuing on. We would expect to know and understand how that post was contributing to the programme objectives. Is the funding aimed at creating more jobs and employment in the health and wellbeing sector? Not really. So it might be that there is a proposal around sort of job creation and labour market initiatives that happens to sort of link to the NHS, but I think we really need to understand how that fitted with the programme aims. It's not really a simple let's create some jobs in the NHS. So we just need to understand how that fitted with sort of local priorities, local action. And so I don't think it really is sort of about that. A linked question to that was, could funding be used for coordinated facilities for the public to engage in services that lead to healthier lifestyles? I don't think that would be enough, actually. I think there are some case study examples in the report from Finland showing sort of one-stop services where young people could go, say, to a service and access mental health support, but also access recruiters, also access housing. So I think if it was something about services, it would need to be much more than just sort of healthier lifestyle services. Another question here is it purely designed for those areas with high health inequalities or deprivation, or can other areas with lower but still some health inequalities still stand a chance of being successful? And I think absolutely the latter. There is no sort of bar to say that only the bottom deprivation levels can apply. We know that obviously even in affluent areas there are pockets of quite deep inequality. So I think what we're interested in from your EOI is for you to tell us how your proposal will help to either improve health and or reduce health inequalities. We're not going to specify areas that are eligible based on their level of deprivation. Are you looking for new innovative ideas or more interested in existing systems or delivery models which have yet to be measured or evaluated? So I think for this funding programme, we would be going beyond just sort of measurement and evaluation of an existing initiative. I think we are expecting to see change. Now, it might be that there are existing partnerships and the funding can provide a supplementary project or a supplementary intervention. But I think we would need to go beyond just thinking about this as pure sort of evaluation, because I think, as I said before, that's not really the aim of the programme. Another question here, would the Health Foundation be more interested in applications that focus on economic interventions to reduce health inequalities for a specific population, or economic interventions to reduce whole population inequality markers? So I think either would fit with the programme objectives. I think we wouldn't specify that we were more keen on one over the other. The only, I suppose, slight caveat to that is if we were thinking about your community and public participation, that might be slightly easier with a specific cohort, but we wouldn't specify a preference on that basis. And the last question in this sort of section is, does the project have to be one specific intervention, or can it cover a range of smaller scale activities? I think a range of smaller scale activities would be fine as long as there's a clear coherence. I think it'd be quite hard to try and put together a programme of things that were completely disparate, particularly again thinking about the elements of, say, community and public participation, the role of the academic partner. So I think there could be a range of smaller scale activities, but as I say, I think coherence would be really important. So the next sort of question is around funding. So key question here, you've offered a range of funding, 300 to 500k. What are your expectations of where partnerships will be within this range? So based on experience, I know there is a tendency to try and bid at the top end. Now, I think what I would say is that we'll also be considering value for money. So if really your programme or your proposal is actually a sort of a 350k one, but you've bunged in an extra 150k and we can't really tell why, that's not going to score so well in terms of value for money. And I think sometimes it can be obvious when applicants do that. Where we haven't specified that we'd take, say, 2 at 300, 2 at the upper end. But I think if all of the proposals that reach the final stage are closer to the 500k, then we can't fund as many. And so it might be that we have to have some discussions with successful sites at that point around budget. But I think at this moment in time, we're after indicative levels. So I think please think about value for money, and please think carefully, but it will be the full application stage and not the UI stage where we are thinking about really, really closely assessing the budget. What I also say linked to that, we've had a couple of queries about whether the funding would be front loaded or split. Generally, for awards of this nature, we would split them fairly evenly. And we'd try and link it to specific sort of deliverables of, say, a outcome report or starting. So that split of payment might be slightly different across the different candidates and different sites. It's something that, again, we can talk about in much more detail at the full application stage. So another question here, please can we have more clarification around this statement, more focus on how to implement economic development strategies targeted at health rather than assessing the effects of specific interventions. Does this mean that the focus is on evaluating methodologies rather than specific impact? So I think yes and no. So it's probably not just about methodologies, but I think, as we said before, we know that it'd be really difficult to get good longer term outcomes data around sort of quite complex interventions. So I think we're just thinking through, you know, say the role of the academic partner, as we've said, we feel is much more developmental. How can the academic partner support the sites? And that might be, as we've said, data generation, cleansing data sets, theories of change, generating evidence, but also doing maybe literature reviews and trying to really support the sites to bring evidence into their practice. So I don't think it's necessarily around just methodologies, but there probably is something in there around the how of how to do some of this. And I think that brings us to the end of the questions that we've had submitted. Thank you so much to those of you who submitted questions, and also thank you for those who have listened to this information call. As I said, if there's things that you are still confused about or you haven't had answered, please do contact Olivia via our mailbox on Economies for Healthier Lives at health.org.uk. The application window closes at midday on the 15th of January. And I'm really excited to see what proposals come through, and just to say thank you again for your interest. We know that this is a really difficult time for many people locally. So we do really appreciate the interest that we've had already in the programme. So thank you again.